for natural healing and jumping on today a little bit about hormones, hot flashes, and holistic solutions. Hormones are probably one of the biggest things that we see in the office. And some people are waking up, they're all drenched, they're all sweaty, they're peeling off their clothes in the middle of the night because they've soaked through their sheets, they're tossing and turning. Now they're waking up their spouse because their spouse isn't feeling good because, they're hot, they're kicking the covers, and your husband is, or I've actually had some guys having hot flashes, like they're getting night sweats and things like that because their hormones are off balance. Yes. And did you know that like night sweats is not just for women? Men can get night sweats too, and they can feel drenched and they can feel fatigued and they're just tossing and turning and then they're miserable and then they're irritable the next day. And your spouse is looking at you like you've got horns growing out of your head because you're cranky and you're tired and just all the things. And who wants to live like that, And so you go to the doctor because you don't feel good. And you wait for the results and you're darn, that something is going on with you. That, well, my thyroid's going to be off, or whatever hormone that you think is going on, whether it's estrogen, progesterone, testosterone, all the things. And the doctor comes back and your results are normal. Your blood work is fine. And they're just like, well, we can give you a pill for that. Or, like, how's your stress levels been? Don't you love that? Or, it could be anxiety. And you know that there's something else going on. And you just, how are my labs normal? Have any of you guys ever had that? Like where you go and you just know something is off? Because I've been there and done that. I knew that something was off. Actually, I used to become, believe it or not, I usually actually get suicidal a week before my period every single month. And it got so bad, it actually landed me in the psych hospital. And I was told that all my labs were fine. So I got diagnosed with a mental health issue. And for a while there, I thought I was crazy. I thought I was like, it was all in my head. Have you guys ever had that experience? Like where you knew something was just not right in your body and you knew it was more than just a mental health issue and they blamed it on a mental health problem? And by the way, most mental health issues are from hormones, by the way, because hormones, so many of them affect your mood, behavioral changes. And I'm even starting to see, which is so sad, I'm starting to see this more and more in kids, like aggression issues and irritability and things like that. And I'm seeing more and more kids having these issues. And it's truly, truly sad. But yet the labs are normal. So then you're made to think like, oh, you got 5 heads coming out of your neck, and you're put on psych meds or you're given, artificial birth control, which that's what they, excuse me, that's what they did with me, which only made it worse. So those synthetic hormones are actually a toxin and a poison to your body. So what do you do? Did you know that your labs can be normal? Excuse me, but it doesn't mean it's normal for you. So I'm going to take, and I've mentioned this a couple of times, but I'm going to take TSH levels or thyroid hormones. Okay. The average range, okay, of normal thyroid. And by the way, depending on which lab you use, that range can vary. So the average range is 0.4. Some labs say to 4.5, others say 5.1. That's like 4.5 to 5 point, like some say 4.5, some say 5.1. That's like a big, huge, like difference. But as long as you fit somewhere in the middle, we deem you normal. Well, that's a huge range to begin with. So, and not only are we, TSH stands for, by the way, thyroid stimulating hormone. It's a hormone that stimulates the thyroid. So if it stimulates the thyroid, it can't even be measured, or it's not even produced by the thyroid. It's produced by a different gland to stimulate the thyroid. So when we're doing TSH levels, we're not even measuring the function of the thyroid. We're measuring the function of the pituitary gland. But yet, that's what your like traditional labs, your CMP, and things like that. When you do your annual blood work and they add on a TSH level to your like CMP or your BMP or whatever labs you have done, and they add on that TSH level, they're not measuring the function of the thyroid. But then they say that your thyroid is within normal limits. They're actually measuring the function of the pituitary gland, which is a gland inside the brain that pretty much regulates every single function in your body. And it regulates all of your other glands in your body, your adrenals, your thyroid, your parathyroid, like all of the things. It's your master endocrine gland. Going back to the TSH, so when we do blood work, we're basically comparing you to everybody else. As long as you fit somewhere in the middle, we deem you normal. But that doesn't mean it's normal for you. So minimally, you should actually be getting blood work done by a functional physician, a functional MD. They can look at labs a little bit differently. This is partly why I also like quantum nutrition testing, and muscle testing, because blood work kind of gives us a baseline, but I like muscle testing because I'm not comparing you to everybody else. I'm basically asking your body, hey, are you happy with where you're at? And your body says yes or no. And then if it's not happy, then we can find out, well, why? Why isn't it happy? Is it toxins? Is it parasites? All that fun stuff. But I do know how many people I find with hormonal imbalances that are on psych meds, and we start balancing out the hormones. Guess what? They don't need the psych meds anymore. They're sleeping better. They have better energy, their mood, they're less irritable, even young kids. Like my youngest little guy, he's 4, and his irritability is improving. And yes, he had hormonal imbalances. Well, how can a young kid get hormonal imbalances? Unfortunately, from all the toxins, even just regular pollution that's in our air, the chemtrails that we're being sprayed on. All these things that people just don't think of, or you can't even just get away from, because our world is so polluted now. You could be doing all the things, but you can't stop like environmental pollution. And you're not going to live in a plastic bubble. So all the artificial hormones that are in, that the cows and the chickens and everything else that are being fed, this is going to affect your hormones. And it's also going to affect your child's and things like that. So we have to be very, very careful of the foods that we're eating, how many toxins. People don't realize, like even perfumes can have an effect on your hormone glands, and it can affect your endocrine system. So they're endocrine disruptors, meaning they can disrupt the function of endocrine glands, include like your pituitary, your hypothalamus, your pancreas, your thyroid, your adrenals, those kind of glands. And all of those have a big, huge role in your overall hormones and your overall body function. So certain toxins are what we call endocrine disruptors, meaning they cause the glands to not function properly, and then that causes an imbalance in your hormone levels. But you can, again, have normal labs, but it doesn't mean it's normal for you. So we look for things like that. We look for what organs are functioning optimally, which ones are not, and then the cause. And so many people have, they have the hot flashes. Even your blood pressure is regulated by hormones, your sleep cycle, your energy, your metabolism, even your gut. Did you know that IBS type symptoms are an early indication of thyroid dysfunction? Yeah, IBS, which is irritable bowel syndrome, which can be a combination, like it's either mostly constipation or mostly diarrhea, or sometimes it fluctuates in between, along with like bloating, abdominal pain sometimes, and it's not comfortable. And that can be an early indication of thyroid dysfunction, because did you know that your thyroid actually and your hypothalamus help to regulate gut motility? A lot of people don't realize that. So a lot of people will have classic symptoms of thyroid. Let's talk about just thyroid dysfunction. They'll have classic symptoms of thyroid dysfunction. So thinning hair, their nails, they got ridges on their nails, or they got like lines on their nails, or their nails are brittle or they're thin. They got dry skin. They got IBS type symptoms. They can have palpitations sometimes, not all the time. They have brain fog, memory issues, sleeping problems, anxiety, depression. And even like their PMS issues can be related to the thyroid. And they have all the symptoms, but the TSH level is normal. So then they're put on birth control to regulate their periods. Then they're put on anxiety medicine, to help them sleep and to help with their anxiety. They're doing like all these crazy diets and things like that, trying to lose weight, you know, and they're given medications for birth control or for their blood pressure and whatnot. And it's all the thyroid. And everything is screaming the thyroid, but yet it's being missed. And you're on like 20 gazillion pills. And the funny thing is that you're on these pills and you still don't feel good. You still have some lingering symptoms. Why? Because the medications are just masking. It's putting a Band-Aid on those symptoms. You're not addressing why do you have those symptoms in the first place. It's like chasing the symptoms without finding the root cause. And then once you do find, like, so in holistic health, so we might find that it's the thyroid, but then we beg the question of like, well, why is the thyroid not happy? Is it toxins? Maybe you're eating foods that's causing inflammation. Maybe it's Lyme or Lyme co-infection or mold. Maybe it's parasites. All of these things can actually cause an imbalance in your hormone and disrupt your endocrine system. So I don't even want to just give you supplements that this, of course, I'm going to give you supplements to support your thyroid. But if I don't address the underlying cause of why the thyroid's not happy in the first place, then I'm no different than Western medicine. I'm just like literally slapping a Band-Aid over it. And that's where sometimes things like, not that I'm against like CBD and like taking turmeric, and all these things can be really, really healthy and beneficial. But again, like, why do you need it in the first place? Because once you can ask that and you can address the why, then eventually you shouldn't need the turmeric. You shouldn't need the CBD oil. You shouldn't need whatever it is, because you're addressing the underlying cause. You're addressing the why. And we actually did that with one of my patients. Patient came in with a lot of like cramping, irritability, mood issues, irregular cycles, had a whole bunch of other issues, and just was not feeling her best. And she had a whole bunch of things going on. She was testing for parasites, Lyme co-infection. So we were and she had toxins as well. So she came in like she was hungry between her meals. She was tired during the day. She even had stiff joints. Did you know that, by the way, hormonal imbalances can cause stiff joints too? And people think that they have arthritis or they have all this joint pain and it's not getting better. And once you start handling the hormones like thyroid, estrogen, and progesterone, and even testosterone, if those are imbalanced, you can have joint pain and inflammation. It can cause tendonitis and things like that. So she was having joint pain, she was having sleeping issues, and she would have PMS issues, irritability, cramping, and breast tenderness. And for the most part, all of her symptoms literally in less than 3 months are completely gone. Completely gone. Now, I'm even astonished by that. Most of my patients have anywhere from a 25 to a 50% improvement of their overall symptoms. She had an 88.5% improvement in just 3 months of her overall symptoms. 88.5% improvement. It's like huge. I have a lot of patients over 50%, but she's so far my highest one. Her sleep is completely improved. And why? Because we addressed the underlying cause. We found out that she had hormonal imbalances and her thyroid hormones were off balance, her estrogen was off balance, but then we found out why. And it was parasites, Lyme, and toxins. And we addressed those, and that's why she's better. Yes, we gave her supplements to help balance out her hormones until we can get rid of the underlying cause. And once the underlying cause is addressed, a lot of times you won't need the supplements to support the hormones because now you don't have anything irritating them. I don't know if that makes any sense. So we want to get to the root cause. Yeah, and in just 3 months, 88.5% improvement, like huge. And let's say you had a 20% improvement of your overall symptoms in 3 months. What would 20% improvement be for you? What could you do if you felt 20% better than what you feel like now? For a lot of you guys, that would be amazing and huge because most of my patients, they're stuck. They've done all the things. They've done all the testing. They've done the lab work. They've done all the diagnostic testing. They're put on pill after pill after pill, and they're just not getting any better. There's no movement of the needle. And they're stuck in their healthcare. They're stuck in their journey. And then they feel like that this is the best it's going to be. And it doesn't necessarily have to be that way. When was the last time you guys actually felt good? When was the last time? One of my patients told me earlier, the last time that they felt good, and they're in their 30s, last time they felt good was when they were in high school. High school. And even then they were having issues. When was the last time that you truly felt good? And wouldn't it be nice to start feeling good again? If you guys are possibly interested in finding out what's going on with you, call for a free 10-minute discovery phone call. Or you could even sign up for a limit. We're having it for a very, very short period of time still. You can get the MVX Plus test. And this kind of gives you an idea of like your overall health, whether you have malabsorption issues like your malnutrition, whether you have mitochondrial issues, whether you have toxicity issues, whether you have some sort of hidden infection going on in your system. It doesn't necessarily differentiate the type of infection, but it lets you know, hey, that you have some immune challenges and infections going on in your system. Gives you an overall kidney and liver function. So it's normally $100. We're still extending it for only $30. $30. If that's something that you're interested in, give us a call. We can get that scheduled. You don't have to come in. So you would get that scheduled. You get the blood draw, and then you would set up an appointment. The blood draw usually takes 3 to 4 business days. Weekends don't count. 3 to 4 business days for us to get the results. And then you'll schedule a phone call with us and we'll go over the results together. So typically that's $100 for But now through the end of February, it's only 30. It's still only 30. So take advantage of it. Give us a call, 708-694-4092. And then at least they'll give you some direction. It's a little bit more in depth. They found out that it is more in depth than doing like traditional blood work. It's a little bit more accurate than, for mortality incidences, to give you an idea of like your overall health, than putting like all the mortality risks, such as like, obesity, heart attacks, cardiovascular disease, diabetes, putting all those risk factors together. This MVX Plus blood test is actually more accurate. They did a study on over 300,000 patients over a 10-year period. And they're starting to use it as like a standard of gold for medical care and for diagnostic testing. So for only $30, you get to find out a lot about where your health is at, and I'll give you a starting point. Again, 708-694-4092. Have a good night.